Have you noticed that recently some Hollywood stars look a bit exhausted, thinner and gaunt? What has happened to them? Let's talk about this topic today. Meet Ozempic face, a complication that more than 50% of people using this group of weight loss medications face. Why does this phenomenon occur and how can it be prevented? Stay with me, and today you will learn what to do to prevent Ozempic face. Weight loss medications consist of three groups: semaglutide, tirzepatide, and liraglutide. These medications can help with weight loss, but they were originally developed for the treatment of diabetes and later became known for this side effect. Doctors and scientists noticed that patients began to actively lose body mass. Therefore, they attracted the interest of all scientists and released special formulations of these medications specifically for the treatment of obesity, such as Wegovy and Zepbound, which are practically the same molecules as Ozempic and Mounjaro, but are now FDA approved specifically for the treatment of obesity without the accompaniment of diabetes. The mechanism of action of these medications is that they block appetite. A person simply does not feel like eating. They also affect insulin levels, increasing it, which regulates the level of glucose in the blood, and so a person simply eats less. Now, there will be reasons why Ozempic face occurs. The thing is that a person simply consumes a smaller amount of nutrients, such as proteins, vitamins, and minerals, and all of this leads to a suffering of collagen synthesis. Now, we will talk in more detail about this mechanism. Collagen is a protein that is synthesized from amino acids, which are essential and come into our bodies from foods such as fish, chicken, meat, eggs, and dairy products. But when a person has no appetite and likely even an aversion to protein foods, which occurs with Ozempic and medications of this group, they simply do not want to consume protein, and its levels in the body drop sharply, leading to the breakdown of collagen and causing the face to sag, resulting in loose skin. The second point is that fat tissue is lost, particularly deep fat. Fat compartments shape the contours of our face, and when deep fat melts away, the face becomes more gaunt. So, imagine that the fat on the face decreases, which serves as a sort of cushion for the face to appear taut. When it is lost, the face becomes gaunt, and the skin sags due to the loss of collagen, resulting in a worn-out, unattractive appearance. This is what is referred to as Ozempic face. Just imagine you have lost 10 or more kilograms, feel slim and light, but when you look in the mirror, you see a sagging old man. The skin on your face and body has simply sagged, and you don't look very attractive, with a complexion that leaves much to be desired, dull, and yellow. But what can be done about it? Is it possible to stop this process? In fact, yes. So the first thing to start with is a balanced diet. Your diet should consist of 1 to 2 grams of protein per kilogram of body weight. If you are not losing weight, but if you are losing weight, then you need support, because what is primarily being burned, of course, are muscles to prevent the loss of muscle tissue, which serves as a prevention against sarcopenia or muscle aging, and also to prevent your facial skin from sagging. Add protein to your diet. Increase its amount by 2 times, 2 to 3 grams per kilogram of body weight. On average, you will be getting about 150 grams of protein daily, and it really is a huge portion and it's hard to gain. For example, your breakfast should consist of cottage cheese, 2 eggs, a large chicken breast steak for lunch, and a whole fish for dinner. Indeed, a person who is losing weight on Ozempic may experience feelings of aversion and nausea. They simply may not want to eat such a large volume of food. So how can you increase your protein intake? You may ask. The thing is, you can resort to supplements. For example, athletes use protein, which is mixed with water to make a milkshake. It will serve as an additional source of protein for you. Either drinkable collagen, for example, from fish, which we produce, our clinic sources from Japan, and thanks to this collagen, by drinking it every day, you will also have an additional portion of protein in your diet, which will help prevent issues such as Ozempic face and sagging body. A sagging body will be associated with the loss of muscle tissue, which is precisely what defines our beautiful shapes. And losing it, this process is called sarcopenia. You will lose beauty along with it.
And so, when you lose muscle tissue, in addition to Ozempic face, you may develop Ozempic butt, where your butt becomes saggy and unattractive. The second point is, of course, injection cosmetology, which should be performed in a clinic by a qualified cosmetologist. When the skin is more vulnerable and loses collagen, it is very important to approach rejuvenation correctly, as during this period of weight loss, it is undesirable to additionally stimulate collagen with harsh procedures such as RF or thread lifting, which can lead to further loss of fat tissue and worsen the condition of your face, making it appear even more gaunt. The thing is that during weight loss, the body lacks resources, particularly protein, and when you stimulate, collagen externally through device procedures, unfortunately, the stimulation will be ineffective and you simply won't notice any results, and possibly your skin will become even worse. Therefore, it is very important to maintain your face and skin during the course of treatment with Ozempic using products such as Charisma, for example, liquid collagen, hyaluronic acid, or a new product with PDRN, which is derived from fish roe. This is the so-called salmon sperm, which Kim Kardashian actively uses to maintain skin turgor. And by the way, we can see that during weight loss on Ozempic, her face remained tight and beautiful. The thing is, she actually used this medication. Therefore, it is important to pamper your skin with special vitamin and collagen mixtures such as Charisma or the Twace product while losing weight on medications like Ozempic. Indeed, they will help maintain turgor, and after you have completed the therapy course and recovered, you will be able to undergo more serious hardware procedures such as RF lifting or SEMAS face lifting. In addition to nutrition and protein supplements, be sure to include omega-6, which will help maintain turgor in your skin. So we have figured out the Ozempic face, but what should we do about the body, since the skin will be saggy there as well? There are special procedures using the new unique laser therapy device iKung, which involves microavioluminal stimulation of fascia and muscles, as well as the loss of adipose tissue. It tightens the skin, and we can see amazing results from it. Therefore, for everyone undergoing a weight loss program, we recommend completing a course of this therapy and also maintaining it once a week. This unique procedure will allow you to lose weight effectively and achieve great body contours without sagging or loose skin. Therefore, to avoid Ozempic face, remember just 3 simple things. The first is to ensure an adequate amount of protein and omega-6 in your diet. The second aspect includes procedures for both home care and treatments at the youth clinic, which will involve injections such as collagen and PDRN. And thirdly, it is essential to take care of your body. During weight loss, it is important to undergo slimming procedures using devices such as iKun or Endosphere. I recommend iKun as it is a microneedling stimulation and it really tightens the skin. We see amazing results in our patients. And when you lose weight, you won't even notice that your skin has sagged in any areas. All these points are very important to consider before starting a weight loss course with Ozempic. Indeed, knowing that you may experience an adverse effect such as Ozempic face, it is better to consult a specialist, an endocrinologist, and a cosmetologist who will create an individual weight loss program for 6 months and a checkup before it to identify any deficiencies. If you already have a deficiency of protein or ferritin in your body, you will only worsen your condition and your skin and face will become more saggy and unattractive. If you have noticed similar phenomena while losing weight, be sure to share your experience in the comments and we will discuss it together. Make sure to subscribe to my channel and like this video. Also, don't forget to share it with friends who are planning to lose weight on Ozempic. Let's take care of beauty and health together.